and resistant malaria elimination in Cambodia. My name is Thais Winkelblack. I'm an ICFRC board member and today's program host. As always, we thank our members, supporters, and interns for making these programs possible. I want to acknowledge our organizational supporters today, the University of Iowa's International Programs, the University of Iowa's Honors Program, the University of Iowa Public Policy Center, and the Stanley UI Foundation Support Organization for their financial support. And also, as always, a big thank you to City Channel 4 and the UI Digital Libraries for helping us continue to make our programs available beyond our presentation today to our online audiences. We would also like to mention our gratitude to the Iowa Arts Council for their financial support through the Iowa Arts and Cultural Recovery Program that has been instrumental in helping us make ends meet during this unusual pandemic time. As we get started, I just want to cover some Zoom etiquette tips. This is the time to make sure you know where your video and audio mute buttons are. And as with all technology, it's a little bit different depending on what device you're using. Many of the devices, you'll see these buttons at the bottom of your screen. So you can practice muting and unmuting if you're not sure. I can see many mute buttons on your pictures, so I feel confident you guys have this nailed down by now. Also, later in the program, we will use the chat function, and so you can make sure that you know, along with the participants, where the chat box is on your screen. Sometimes if you're using a different device, it could be on the top instead of at the bottom or along the right-hand side. I also recommend that you switch to speaker view and be able to just see Dr. Etienne and his presentation during the program, and that you keep your own video muted. I think most of you have that down pat by now. Once we get to the question and answer piece of things, we would love for you to put keep your audio on mute so we don't interrupt the questions or disrupt our speaker's remarks, but to unmute, so to speak, your audio so that we can see your faces and have a little bit more of a sense of what our ICFRC luncheons would be like during the Q&A. Always my favorite part of our presentations. We will have the remarks from our speaker ending around 12:45 p.m. or so, and then we will start our Q&A period usually around 15 minutes. And we'll, as I said, have you submit your questions through that chat box. So again, thanks for muting so we can keep any background noise to a minimum. And with that, it's my pleasure to introduce today's speaker, Dr. William Etienne. Dr. Etienne is a medical doctor with 15 years of experience in humanitarian medicine. He has worked for Doctors Without Borders, the International Community of the Red Cross, and the World Health Organization. His areas of expertise are health in conflict, health in detention, response to outbreaks, decentralization of care, primary health care, and malaria elimination. From 2016 to 2019, he was involved in malaria elimination in Cambodia, and he has recently relocated to Iowa City, where he works in infection prevention at the University of Iowa hospitals and clinics. I'm sorry that we missed the pre-luncheon chit chat that I would normally get to have with you before your remarks started, Dr. Etienne, but very much looking forward to your presentation illustrating the challenges with malaria elimination efforts while responding to the threat of COVID-19 in Cambodia. And we welcome you, and I will turn it over to you for your remarks.
Hello, everyone. Thank you, ICFRC, for inviting me for this presentation. I'm going to try to share my screen and make sure that you can see it. And I wish it was your... Can you see my screen?
We sure can.
Okay. So I see my screen, but on the wrong monitor. I'm going to try to see if I can move it to this one. No. So I may not be looking at you directly when I do my presentation. I apologize for that. Let me see if I can do that. This might be better. Okay. Am I facing the screen?
Yes, that
Okay.
looks good. Thank you.
Yeah, thank you. So yeah, I worked in Cambodia before coming to Iowa City, and my work was related to trying to eliminate malaria in Cambodia. And I was asked earlier for another venue to make a presentation, and I thought, hey, let's address what it is like to try to eliminate malaria when you are hit by COVID-19. And so in this presentation, I will present to you the situation regarding COVID-19 in Cambodia, and then share with you what efforts are being done to eliminate malaria at the same time. So Cambodia, it's a small country. It's about 1.25 the size of Iowa. It's in Southeast Asia. You see on the map that it's bordered by Thailand, Laos, Vietnam, and it's quite close from China. It has a population. Yeah.
Dr. Etienne, I'm sorry to interrupt, but we're still just seeing the screenshot of where your documents are, where your presentation's saved.
Sorry. So let me try to see if I can do.
It wouldn't be Zoom without a few tech issues.
Yeah. So I'm not the best expert in Zoom. I want to stop sharing and then I'm going to share again. Yeah, I shared the wrong screen. So this is why you couldn't see anything. Thank you for telling me. So now it should be better.
That's perfect.
Okay, let me put them. Okay, good. So I was showing you the little country of Cambodia, which is bordered with Thailand, Laos, Vietnam, and as you see on the map, it's not very far from China. It has a population of 16.5 million inhabitants. It's a very young population. 65% of Cambodians are aged less than 30-year-olds. And if you're looking at the age pyramid, you see this big gap over there in the generation from that have around 40-year-old, and you see that 20 years later it's repeated, and then again. This is linked to the genocide, the Khmer Rouge genocide that occurred in the 70s, and that killed more than 2 million Cambodians. So it's a country that has been through quite some turmoil in the 20th century. The average salary, I'd say the minimum salary wage for people that work in the garment industry is $170 per month, just to give you a bit of an idea of the economic situation in Cambodia. And economic or incomes in Cambodia, economy is really driven by tourism, 6 million tourists normally on average per year. It's driven by the agriculture, a lot of rice plantation, and the garment industry. In fact, a lot of the clothing that are worn by American brands like Carter, Gap, Abercrombie, Old Navy are manufactured in garment industries in Cambodia. It's ruled, with a strong fist by the First Minister Hun Sen since 1985. And it's a tropical country with a rainy season and a dry season. And with I think the coldest would be around 80 degrees in Cambodia, and it can go really beyond the hundreds degrees Celsius. On the flag here, you see the the temple of Angkor, and this is Angkor Wat in Cambodia. This is a very big tourist destination in Cambodia. So COVID-19, I think the first time that Cambodians started to really worry about COVID-19 was in January 2019, when a lot of students that were in Cambodia started to share their distress and their fear of being stranded in Wuhan. There was around 100 Cambodian students that were in universities in Wuhan, and they were stranded there. And there was some concern from the Cambodian community population and the families of those students for their health. And at that time, the first minister shared that we have to stay with our friends in need in China, and that the students wouldn't be repatriated home, but that he would go and visit them. And he went all the way to Beijing, but then didn't end up going in Wuhan. But that's really was, I think, a time where the threat of COVID-19 started to ingrain in the mind of Cambodian. And then a very big event, which was in the international news, was when this cruise ship called the Westerdam that had on board, I think, 1,600 passengers, among which more than 600 American, had disembarked in Hong Kong, where the epidemic was already hitting. And after, the next stop was supposed to be in Japan, but Japanese authority didn't allow the boat to disembark in Japan. It then tried to go to Taiwan, Malaysia, I think, and the Philippines, if I remember well. But none of those countries would allow the boat to disembark because they were afraid that it would be a source that passenger might have been infected by COVID-19 in Hong Kong and might transmit while disembarking in their own country. And the Cambodian authority came up and said, well, we will help out, and we will allow the Westerdam to disembark in Cambodia. And I think passenger had been sort of stranded at sea for more than 10 days before Cambodia came up and say, well, we'll allow those passengers to disembark. All passengers were tested for symptoms. Those that had symptoms were treated. And then they were asked while disembarking to quarantine in their hotel. Some, though, passengers decided to continue their journey. And one passenger, in fact, was an American woman who was age 83. And while she was transiting in Malaysia to fly back to the US, was tested positive for COVID-19. So that created quite some concern. And then the quarantine of passenger was strengthened, but then they realized that many passengers had already continued their journey. So a list of passengers had to be sent to all of the embassies of all of the passengers, so that contact tracing and testing could be done upon arrival in their own countries. The first case of COVID-19 that was transmitted within Cambodia occurred on March 7th, before all of the cases that had been detected in Cambodia occurred in international travelers that had been infected overseas. And that also started to really worry Cambodians authorities, because if you start to have local transmission, then your big concern is that it's gonna spread in Cambodia. And there was really quickly contact tracing around the case. It was in fact someone who had been in contact with a Japanese worker who had recently arrived in Siem Reap. So big measures were taken, and one of the emblematic public health measures that was taken was the cancellation of the 3 holidays that are given every year for Khmer New Year. Khmer New Year is a very, very big event. Usually, Cambodians have 3 days of holidays around the weekend, so that's 5 days of holidays. And they all go back from the cities where they're working to their village, where they meet with families and friends and party, go to the temple, pay tribute to the spirits. And that would have been a really big risk of wide transmission within the country. So the decision was to not to have those 3 holidays and to ban any travel to the provinces, so inter-provincial travel. So imagine Thanksgiving in the US, and a decision is made that there's going to be no interstate travel on that day, and that we're not going to get our holidays. More recently, there was a big concern around the cluster of cases, and this is one situation where there was not just one contact of a international traveler that got COVID-19, but there was a few local transmission cases, and that could be related to a big cluster. That was, and there was quite some concern because there was some employees that got infected, and person that got infected that had been shopping in the biggest mall of Phnom Penh. And there was a huge contact tracing being done with more than 2,000 Cambodian being tested and put in quarantine to try to prevent that cluster to spread over Cambodia. There was some concerns also about a spread of COVID-19 in prison. From the information that I got in the media, and looking into the source of that cluster, there's 2 hypotheses. One was a diplomat from Hungary who had traveled and later tested positive in Cambodia, and had been in contact with some authorities, and among which a director of the biggest prison of the country. So it was quite a big concern in the country, with quite some important government staff that were in presumably contact of cases. I think the malls was closed for quite an amount of time. So if you're looking at the epidemic curve of COVID-19 in Cambodia, and you're looking at the total number of cases reported so far, you see that it's only 463, which is really good. It's less than 2 cases per day. And if you're looking at this curve here, you'll see in dark blue, it's imported cases. So all of those cases are cases that have been detected in international travelers that during their quarantine in Cambodia. In orange are the locally transmitted cases of COVID-19. So COVID-19 contracted by Cambodian who hadn't traveled outside the country. And so as you see, this here is the cluster of that I was just talking to you about that occurred in November. And you see here that cases are starting to rise late December and in January. It could be linked to more travelers going back into the country. There seems to be a lot of those that are from Cambodians living in Thailand and then coming back to Cambodia. But so far, as you see, there isn't much local transmission reported. And then you might also object, does this reflect reality? Are there a lot of cases that may not be recorded or reported? From the feedback that I got from colleagues and friends in Cambodia, you don't see hospitals saturated with people with COVID-19 like symptoms or deaths from respiratory infections increasing or being concerned or could be related to COVID-19. So it seems to represent, probably underestimate a bit, but represent quite well the situation in Cambodia. I was also, just to give you an element of comparison, you see that Iowa, with a population that is 5 times less, has unfortunately a much greater number of cases and of deaths. If you're looking at the geographical spread of COVID-19 in Cambodia, it's really centered in the big cities and the urban area. Here, this big circle, red circle, is Phnom Penh. Here you have Sihanoukville, where the Western Dam that I talked about disembarked. Here it's Siem Reap, where you have the beautiful temples of Angkor, and here it's Battambang, near the border with Thailand. But in the area, you'll see later, where most of the malaria cases are detected, the forested area in the northeast of the country, or in the region of Kampong Speu around here. There hasn't been, in fact, so far, I think, a single case of COVID-19 that has been detected. So the current scenario is really scenario one, where infected people come from abroad and may transmit to one or a few local Cambodian. Scenario two, which occurred in November, is when you can't trace all of the cases to one source that has been imported, but there's like a few cases that pop up in a community. And this is a concerning scenario, because if you don't manage at that time to do the contact tracing, identify all the contacts, ensure that they observe strict quarantine, you may reach that scenario which we are at in the US, where you have cases popping up everywhere and you don't have the capacity to do contact tracing and ensure strict quarantine measures of the contacts. So in Cambodia, a big element of their prevention and control of the spread of COVID-19 is linked to border control. If you were to fly to Cambodia, you would require to have a negative PCR test before boarding the plane. And when you would arrive in Cambodia, you would be tested. You would have to quarantine in a hotel under surveillance of Cambodian authorities. You would be tested on the 13th day of your stay in this hotel under quarantine. And if then you tested negative, you would be able to go into Cambodia. And this is, I think, one of a way that they've been able to stay in the situation that they are at. But we'll see that there are other factors also that could explain this epidemiological current trend. Contact tracing and quarantine, of course. There was, at some times in Cambodia, closures of entertainment venues and schools. Schools have reopened. Most of the entertainment venue, I think, have reopened, maybe except some of the nightclubs. Limiting gathering is another measure that is put in place, not always, but in certain situations, in certain region, if there is some concern. And then limitation of population travel during big holidays like the Khmer New Year. There's another big holiday in Cambodia, which is called the Water Festival. And this year, similarly as for Khmer New Year, the Water Festival celebration have not have been canceled. So here you see on the upper on the you see a border crossing. I think it's probably from between Thailand and Cambodia, where mostly Cambodian who probably work in Thailand come back and have to register and go through a screening before quarantining. On the right side is the worker in the garment industries in Cambodia that make a lot of the clothes that we are wearing. On the bottom left, it's at the airport in Cambodia, screening of international travelers, and you see here there's a little quarantine sign. This is, in fact, the Minister of Health of Cambodia. And then here I wanted to show you this, because when I talk to my friends in Cambodia, because there's so many few cases, they tell me that, of course, people are wearing masks more often, and there's, some alcohol hand rub and everywhere to wash your hands. But the social life is still, happening. There is no lockdown. And this was, I thought it was funny when I clicked on Google for Cambodia, they were advertising beer yoga, a nice way to relax at time of COVID. So this is just to give a bit of a parallel between sometimes measures that are in place and how well they are enforced. So what are the factors that could have contributed to low transmission and the low case fatality and zero deaths in Cambodia? The early implementation of the public health measures that I share with you, of course. The Cambodians are a rural population. 80% of the population lives in countryside. Their houses have a very, very well ventilated to also prevent being too hot in the houses. The way that Cambodian will greet themselves doesn't imply any physical contact. So this could contribute to lower the risk of transmission. It's a very young population, so of course this lowers the risk of dying from COVID-19. Masking is in the culture already. If a Cambodian feels sick, even before COVID-19, they would wear a mask if they were to travel in public transport or go to work. And then there are some other potential mitigation factors like dengue fever. Dengue is endemic in Cambodia. There are some research that show that dengue could be a protective factor. BCG vaccine, everyone is vaccinated against with BCG vaccine in Cambodia, and this could also contribute to some protection. And then, of course, the warm climate, the warm, humid climate, that might also contribute to be a protective factor. So although Cambodia hasn't been hit too badly in terms of health-wise, it has really been hit hard economically. Cambodia is a country that has an average 8% annual economic growth, and for 2020, it's going to be a -2%. There's a great drop in tourism. I think it's dropping from 6 million international tourists to probably very few or a few thousand. The garment industry got hit. Now it's starting again, but it got hit for a while at the start of the pandemic with some shortage in raw material and issues with transport of goods. And as in the US and a lot of other countries, there's a stimulus package that has been put in place by the Cambodian government targeting the poorest family and the industry that have been touched the hardest, garment industry, tourism industry, and aviation. So vaccination, the topic of the moment. In Cambodia, in fact, vaccination hasn't started yet. Early on, Prime Minister Hun Sen shared that he would not start vaccination with a vaccine that would not have been pre-approved by WHO. But with the pressure of vaccination starting everywhere, and with cases, as you saw, increasing in December, I assume that he reversed his stand and decided that they would start vaccination as soon as possible. And they, in fact, were offered 1 million doses from the Chinese government, and so the vaccination should start in February or March in Cambodia. They would like to vaccinate 10 million of Cambodian. So this is why they're aiming at 20 million doses. Vaccination would be free and voluntary. One issue in Cambodia with the RNA messenger vaccine is that they need to be kept at very, very low temperature, and Cambodian infrastructure doesn't allow to do so. So they have to go for vaccines that could be kept at the usual standard cold chain temperature between +2 and +8 Celsius. And so it's in the pipeline, vaccination from the COVAX, which is a process that by guaranteeing production of vaccines with funds of rich country would provide free vaccines to poorest countries. And then Australia is giving also a lot of money for them to buy more vaccine via the COVAX mechanism. And they are in discussion with the Indian government, who's developing a vaccine, or India. And then, of course, there's government money and Cambodians' private donations to also look into directly buying vaccines from other manufacturers. So that's for COVID-19, and now let's move to malaria. So interestingly, when I read that very interesting book from Dorothy Schroeder, Iowa, the Middle Land, I realized that, yeah, there was malaria in Iowa, in fact, in the 19th century, and it was a big issue for the settlers in Iowa. If you're looking at this map, this is a map of the U.S. from 1870, and everything that is in pink or red is an area where there was malaria, and Iowa is on the map, and there was malaria in Iowa City in 1870. In fact, if you look at the scale over there, according to this scale, 2.5 to 5% of deaths were linked to malaria. And the US have undergone major efforts to eliminate malaria from the country. Elimination of malaria in the US occurred, in fact, in 1951. So we are celebrating the 70th anniversary of malaria elimination in the USA. And as you see, I mean, this elimination was linked to the use of mosquito screening on our windows, some mass treatment with quinine, and mostly, and you see here a doctor giving a dose of quinine to families, I think, in Alabama. And of course, there was a lot of work being done in drainage of the marshes, an area where the Anopheles mosquito that transmit malaria was breeding. And then after the Second World War, with DDT and chloroquine, that helped to really finish the work of eliminating malaria. So now, why is malaria elimination so important in Cambodia? I'm going to show you a short video. It's because resistance to malaria started in Cambodia. Resistant to chloroquine, which was very good antimalarial drugs, resistant to Fansidar or sulfadoxine-pyrimethamine, which is was a very good antimalarial drug. In fact, started in Cambodia and at the border between them. So if I show you this video, you're going to see the blue spreading is chloroquine resistant. The yellow spreading, I think, is Fansidar resistance. And then the red is just the both combined resistance. And you see how it spreads from Southeast Asia, from Cambodia to Africa, the Middle East. And if it was to, so let's see if it works. So you see it starts in Cambodia over here, and then it starts to spread in South Africa, and then China, and then Africa. And if it reaches Africa, and, when it reaches Africa, it's really a catastrophe, because 95% of deaths from malaria occur in Africa. There's on average 500,000 deaths in the world from malaria, and more in previous year. So I talked about chloroquine, I talked about Fansidar, but now the current treatment for malaria are called ACT, artemisinin combined therapy, which is in fact a combination of two malaria drugs. And in Cambodia have been detected multi-drug resistant parasites that resist to almost all of the malaria treatment that are available, or have some kind of resistance to them. And the concern is that those strains that are multi-resistant or to almost all of the malaria treatment would spread, of course, in the rest of the world. And this is why there's so much focus on the elimination of malaria in Cambodia. So malaria in Cambodia transmitted by the Anopheles, and then this mosquito, Anopheles dirus for Cambodia. And Anopheles dirus likes to breed and to live in deep forests. So you won't find it in the cities. It really transmits malaria in deep forests or in the villages at the fringe of forests. And most of the people that are sick with malaria in Cambodia are, in fact, young men that venture into the forest for economical activities, to cut wood, to go hunting, to pick up some mushrooms, or to clear woods to make some fields for rice crops or cassava crops. So this young man, in fact, got bitten probably just at sunset or before sunset or very early in the morning or during the night, and he got sick. Typical symptoms of malaria are fever, sweat, and shivers. And malaria is typical because it's a cyclical fever. So every 48 or 72 hours, there is a fever that comes back. Falciparum malaria, there's different types of malaria parasite, 4 in fact, but the most dangerous one is falciparum malaria, which if you don't get treated can kill or will kill most of the people. Especially it's dangerous for pregnant women and young child. But in Cambodia, those are rarely exposed because it happens in the forest, where usually it's mostly men that go. So what has been developed in Cambodia to ensure that if you get sick from malaria, you get treated, get tested and treated early, is that in each village where there is malaria, a member of your community, of your village, has been trained to do malaria testing and treatment if the test is positive. And it's really easy to do a malaria test. You prick the finger, you collect a few drops of blood, you put it in this well, you put 4 drops of buffer, you wait 20 minutes, and then if you've got, you see, 2 lines like here, it means that your patient has malaria. And there's then there's a 3-day treatment that is effective still, but for which we need to monitor if there's no more resistance growing. At the moment, it's artesunate mefloquine that is used in Cambodia, and it says 3-day treatment. So you get cured. Of course, what's really important as well is to prevent from being bitten by the mosquito. So to use a mosquito net at night or hammock net at night to prevent being bitten by mosquitoes. So if you're looking at Cambodia, you see that malaria is mostly in this region and in this region. And in fact, 50% of the cases are located here. Why? Because it's densely forested and there's some very precious wood that are very expensive on the market in Asia. And so there's a lot of activities in the forest in this area at the moment. And this is why it's really important to focus the response to those areas and to have a very fine idea of the epidemiological mapping so that you can focus your effort in the right places. Here you see clearing in the woods in a rice plantation. Here is the house of a village malaria worker. There are also forest malaria workers, or you could call them mobile malaria worker, that target essentially forest goer and that go in an area where there's a lot of forest goer. And here you see that lady testing forest goer for malaria. Here is the driver of the malaria transmission in Cambodia at the moment, the commerce of precious woods. And so here's the health center chief coming to look at the registers and bring some malaria tests to a village malaria worker. Here's the test for malaria. So access. So what was the concern when COVID started to hit? There was a big concern in Cambodia that because of COVID-19, the people would fear to go to a health facility and then would get treated late and would develop severe malaria. There was also a concern that those volunteers that I showed you would be afraid to take care of patients, and that would also impair the access to treatment. So very quickly on, there was some training of all of those mobile malaria workers on what is COVID-19 and how to protect yourself, and distribution of personal protective equipment. A big concern was that as malaria COVID-19 manifests with fever, so how could you discriminate between fever and malaria, and how could we protect the mobile malaria worker? And then so in the algorithm, mobile malaria worker or village malaria worker would have to ask, have you been in contact with someone who had COVID-19? And if the answer was yes, then they would not take care of that patient and refer the patient to the health center where staff would be better trained to take care of the case. And if there hadn't been a contact, and as you saw, most of the cases are linked to a contact, then the village malaria worker could do the test. There was a big concern about supply. As you saw, you need to really distribute those supplies in the periphery, those rapid diagnostic tests, and those and the treatment. And so there was a big effort to push as farther as possible in the periphery the supply, so that if there was some disruption in transportation within the country, that there wouldn't be any stock out at the periphery. And of course, there was a lot of work that were done to secure international supplies. And then another concern was because of the COVID-19, a lot of Cambodians came back from neighboring countries, especially Thailand, where the tourist industry was dropping. And a lot of people came back from the cities where they couldn't work anymore in the hotels and the restaurants, back to their villages, and they had to try to make a living. So there has been an increase of activities in the forests to get those precious wood. And so the concern was that these people would get infected, and to ensure that they would be informed about how to prevent themselves from malaria and ensure that they would have access to mosquito nets. So if you're looking at the epidemic curve for malaria since 2018, in red is Plasmodium vivax malaria, which is not as severe. And the one that really matters, for which there is resistance growing, is Plasmodium falciparum malaria. And you see that it's really reducing greatly. And now we are almost, I'd say, in a situation where Cambodia could reach soon Plasmodium falciparum malaria elimination. And in fact, the objective was to reach was to reach malaria elimination by 2025, and now they decided that they would meet falciparum malaria elimination by 2023, and they're aiming for that. And you see that this has been linked to an important increase of testing for malaria. And what's more important even is testing in the right places where you have malaria transmission. Now, to finish the work and to really clear Cambodia from malaria, some aggressive intervention have just started, in fact, last month, which are house-to-house fever screening in those few villages, an area where there's a lot of malaria and malaria transmission. The village malaria worker will go on a weekly basis to all of the houses and screen for fever. And if someone has fever, test them and treat them. Targeted drug administration, this is for villages where there is transmission of malaria that are near the forest and in which there's a lot of people going into the forest, where at the transmission, at time of malaria transmission, you will treat with malaria on a monthly basis everyone to clear the parasite from the area. And then there is also in other villages where there is no transmission, but there is transmission among people that go into the forest on regular basis. The offer of a preventive treatment. So if you are planning to go into the forest to cut down wood, you can go and see the village malaria worker and request for a treatment for malaria, so that you can prevent from being infected, like you would do if you were, for example, to travel into a malaria endemic area in Africa, and you would take your Malaron, for example, before traveling and during your trip to prevent from being infected. So malaria elimination experience applied to COVID-19 elimination. It's two different diseases, one virus and one parasite. But I think one key message is it's really important to test more and test early. I think it will be more and more important as we hopefully have less and less cases to have a very fine epidemiological mapping, so we could target surveillance and prevention for the population that are most at risk of acquiring COVID-19 and the location where there's a higher risk of transmission. But thankfully, we have a vaccine for COVID-19, and and if we manage to deploy it quickly and it remains effective, then I hope we'll meet herd immunity. Unfortunately, for malaria, there is no effective vaccine right now. There's one under development, which is in phase 3, which has shown some efficacy. But we're not talking about 95%, it's more around 50 to 30%. And the immunity doesn't last very long. And there's another also issue about if you've been protected, but then you know more, then you didn't have the possibility to develop an immunity that might be a protecting factor later against malaria. So thank you very much for your attention, and I'll be very happy to answer any questions that you may have. And I'm sorry if I lasted a bit long.
No, that's wonderful, Dr. Etienne. Thank you so much. And it's nice to hear some good news, because it sounds like primarily Cambodia has been a success story in both malaria eradication and COVID-19. So before we transition to the question and answer period, I just want to note, some of you are old hat at this, but we would ask you, if you'd like to turn your video feed back on so that Dr. Etienne has a chance to see your face while he's speaking. We also then will have you put your questions into the chat function. And so often, as part of the buttons on your screen, you can see participants and chat. The chat's a little text box that you can click and put your questions in, and I will help moderate the Q&A. And while we're just waiting for a few more questions, I'll note that the ICFRC will continue to send you an email when we have programs so that you have an opportunity to register. But for those of you who might want to look ahead and see what's on the schedule, or plan in advance for your calendars, you can now view much of our spring semester on the website, which is icfrc.org. So feel free to go out and take a look at that. And I wouldn't be a good member of the board if I didn't mention that the ICFRC does rely on our members primarily to fund us. And since we've moved online, we don't always have the opportunity to have all of our members interacting, but we have had the opportunity to have some new people join us. And should you see fit, we would love for you to make an online donation, and we've put that in we're putting that in the chat box. You can also find our program link there. The really great news about the ICFRC is we aren't a big, expensive organization, so even a small donation makes a difference. With that, I will go to the Q&A section. And Dr. Etienne, the one question here is, the questioner is asking, what do you think are the reasons that Cambodia can mount effective public health campaigns, and Iowa, and as you showed us, and the US cannot?
Assumption, I don't hold the truth, but one reason is probably that it's a very centralized power, and it's it's what those hard states. So I think that if a decision is made, it's implemented and quickly, and people do what they're told to do. I think also it's linked to the it's been quite successful all around Southeast Asia. I mean, the Vietnamese have done very good into responding to the epidemic. Thailand has done good. Laos, Myanmar, we'll see. And I think sort of the very early on control of borders has helped, and then there's all of those other factors. Maybe they have some protective, maybe they're, as I shared, with BCG vaccination, could dengue, could the fact that it's a rural country where people live outside, have very, the houses are very ventilated. This might have contributed a lot into preventing an exponential growth of cases, which meant that the control, the tracing and the quarantine measures have been possible and successful. If you have so many cases that pop up and you have disorganized response, then of course it's going to be more difficult. If it's a centralized, and centralization is not always good, but if there's a clear message that's just being shared on this is what we're going to do to respond to the issue, and you better do it because it's Cambodia, and there are some consequences, and you're not submerged by cases, I guess it's possible, but we don't know what's going to happen in the future. Yeah.
Good, thank you. Another participant today would like to ask you, if a patient has been diagnosed with malaria, does it remain in the patient forever? Maybe you could tell us a little bit about how it works and what the long-term effects are, if there are any.
Yes. No, that's a good question. It depends on which parasite you're infected with. There's 4 different types. There's ovale, there is Malariae, and then the most common ones are Vivax and Falciparum. So Vivax, if you're treated and you have Vivax and the treatment is effective and it kills all the parasites, then you'll not get malaria again unless you're bitten again by a mosquito that carries the parasite. On the contrary, if you are infected by a mosquito that carries, for example, Plasmodium vivax, then Plasmodium vivax stays in the blood, but also goes into your liver in a form that is called the hypnozoite. So it's like a dormant parasite. And the treatment that we use to treat malaria, which is artemisinin combined therapy, doesn't kill the hypnozoite. So you might be treated, get better, and then have a relapse. And you would have a relapse, for example, if you have the flu or if you have another disease and it lowers your immunity, then the parasite might decide to relapse, take the opportunity that you are weaker at that moment, and then you'll have fever again. So if you want to treat and if you want to kill the hypnozoite, then you need to add to your treatment a drug called primaquine. Now, this drug has some issues because in people that are G6PD deficient, which lack this enzyme, it's going to provoke hemolysis, and you might have a very severe anemia. So you need to be tested for G6PD deficiency before you can receive the primaquine. And there isn't the access to that test in Cambodia, for example, is not so easy. So there's a lot of research being done right now on how to develop a safe G6PD deficiency rapid test.
Good, thank you. Okay, because a lot of times, Dr. Etienne, we're speaking about sort of the global political elements related to the topics that we discuss. I'm going to ask you one question which you are allowed not to be the expert on, and you can make a guess, and then one question that might actually relate to your work and your topic. This questioner asks, with the de facto one-party rule, what is the likelihood, in your opinion, that Cambodia will transition to true multi-party rule? Do you have any sense of that or not? And then the medically related question is whether or not the UK or South African variants of COVID-19 have reached Cambodia yet.
So I start with the second question. I don't know. I don't know. I mean, there's the Pasteur Institute, and there's, I think, NIH working in Cambodia. So they are probably looking into that right now. But I don't know. And then regarding the other question, I don't know. I mean, but I mean, lately the attempts haven't been really successful. Let's put it this way. And I think that yeah, I think there's going to be a transition at the end of. I mean, when Hun Sen sees power, then it's going to be a time that we'll have to watch carefully.
Yeah, thank you.
Yeah.
Do you have any comments or knowledge about the other countries? You mentioned some of the Southeast Asian countries and their ability to sort of manage COVID and malaria, but do you have knowledge of any of the other areas and how they're doing, whether COVID has had a really negative impact on malaria eradication?
In fact, I was looking because there's like WHO has like a regional monitors the regional data for malaria and COVID-19 in Southeast Asia and in the Great Mekong sub-region, Laos, Thailand, Vietnam, Cambodia. Malaria is going down, and COVID is under control and has gone. There's some concern in Thailand at the border with Myanmar, where there was more cases of COVID-19 that have been diagnosed. And Myanmar is probably the country which is the most concerning, and especially now with the coup. But I'd say the trend is that COVID-19 is under control and malaria is really diminishing. I hope it will stay this way.
Good. Good. Well, thank you so much, Dr. Etienne. We've reached the end of our questions. Actually, one more, just a little bit more on a personal note. Are you here at the University of Iowa long-term or for a specific period of time? Will we get to see you again? I think.
No, you'll get to see me. I'll get to see you because I'm looking forward to see some of the other presentation. No, my wife I came to Iowa to accompany my wife, who's the interim director of the Global Health Department, or it's part of the international. I'm sorry, I'm not very good at that, but my wife is a lecturer at the university.
So, good. So maybe we'll get to hear from both of you again.
Yeah, I'm sure. That would be a pleasure. Just a little note. It's funny because I used to work for the ICRC, the International Community of the Red Cross, and there's also the ICFRC, the International Federation of the Red Cross and Red Crescent. So every time I receive a mail from ICFRC, I just like, I think about my past work for the International Community of the Red Cross.
Absolutely. Yes, we're a much smaller organization. So, well, good. Thank you so much for your presentation today. Normally, it would be my pleasure to present to you as a token of our heartfelt thanks for taking the time to present to us today, an ICFRC mug for coffee, tea, or beverage of your choice, or maybe for using at your next beer yoga session. We will present that to you virtually and then follow up with details about coordinating how to get that mug to you. So
wonderful.
Our sincere thanks to you, and thanks to all of you, our viewing audience, for joining us. And again, thank you to our sponsors for their generous support. With that, we are adjourned, and have a wonderful rest of the day. Thank you.
Thank you.